Well, the Center for Optimal Aging has the goal to be an interactive and interdisciplinary center. So the initial idea was to serve the community and serve the times. As we know, our population is growing older and wiser, so they want to be participating in activities, have this active lifestyle. And we serve many of our aging organizations in the community, and so for that, the Center for Optimal Aging was such a nice fit for the current time.
And your center involves collaboration between a number of different academic programs. Can you elaborate a little?
Yes. So it is an interdisciplinary center. So when we think about aging is all of us, right? So aging applies how we are going to be working with older adults, or even now how older adults is going to be into the workforce. So as we are living longer, and we might have several professions, and with that, we're going to be interacting more what we call with this field of optimal aging, with people who's going to be working in the workforce, or with adults that's going to be in need of other special adaptations. So for that, it's so suitable to School of Business, social work, nursing, all the allied healthcare professions, as well as those liberal arts professions that will and are serving older adults, such as fashion and, as I mentioned, engineering, designing new products that's going to be suitable to the older adult population.
And Mahi, what are you studying here, and what are you involved with around campus?
So I'm currently learning information technology with a specialty in data science. I work as a graduate assistant, so most of my work in the center is developing the website and gathering resources so that we can give access to resources for older adults, so they can use them for better enrichment in their lives and utilize those to promote more information and more knowledge about aging in terms of what I do in the center.
And what's interesting is that this center didn't exist when you came to Marymount and
Yes.
chose your course of study. So how did you become involved, and how has it helped you now as you prepare for a career after Marymount?
So when I first joined Marymount, I didn't know about the center, but I was there when it was initially developed. I was mostly helping out with the website and in terms of getting it updated. But now that I've been here, I've realized that all of us are affected by aging. And one of the colloquiums we did was in Alzheimer's and dementia, getting knowledge about that. And that's something that's close to me because my great-grandma had Alzheimer's. And it's so interesting to see how the center tackles those things, and maybe seeing how different academic programs are also involved in it made me realize that that's something I could be interested in and maybe pursue in the future in terms of graduate school, or something that I can do in the future as well.
So Dr. Heyn, what are some examples of how our student scientist fellows are able to help with the biggest goals of the center?
Yes, so many. So we have so many areas. So the center has 4 cores. Has the research one core where we develop projects directly with older adults in the community, and so we want that intergenerational perspective. So we want the students to help us in implement those studies and have that contact, that connectedness with the adults, and that authenticity as well. Like when you build those relations, there is that emotional component as well. And in terms of the other cores, we have the training, so we want to also specialize more the workforce to serve the older adults and increase this awareness and the opportunities with this field that are so unlimited. So we have several potentials for training, and we are working on a gerontology certificate. So that's going to be applied to any of the schools and any of the programs, so it could be an add-on as a specialization, in the way when you go to the workforce, you add that discipline and that specialty, those skills into your CV, and makes you a better candidate for the jobs. The other areas, advocacy. So we need more policy. We need to improve healthcare and services for older adults, especially since the population is growing, and that means the needs are going to also enhance. So it's very important that our early generations be proactive and start to work towards changing some of those policies and implement new ones.
But as populations begin to live longer, how could your center's work actually help reduce healthcare costs?
Yes, that's an excellent question. We always say that $1 million question, right? It's so important to reduce healthcare costs. One of our goals in terms of contributing to that is what we call the active aging or aging in place. So we are working towards what we call a functional health research laboratory, where we're going to help our adults, not only older, but through their lifespan, to understand about some biometrics and functional measures that you easily can implement in your daily life in your home, and can guide you to areas that you can work towards, like making those improvements for yourself to keep yourself fit and active, like ambulation. So we always underestimate the power of being ambulatory, going from one point to another one. But as we grow older, we know that we are impacted by a possible impairment in gait. So keeping our older adults independent, mobile is so key and so important. And we work very closely with our rehab and PT researchers in developing balance fall preventions and balance enhancement and exercise to keep our older adults active. And now we are adding a brain health component where we are connecting, we call active legs, active brain. So in the way you keep both important organs and components of health active.
And just final question, this is Day of Giving, so, what fundraising goals do you have for the center, and, what pitch do you want to make to any of our members of our community watching?
Yes, we couldn't do anything without the support and the champions that we have. The center has many ambassadors and representatives in the community, so we really honor and appreciate the pledges and the assistance of our donors. So for saying that, any pledge is a good pledge, and all your contributions always go to a good cause. So we appreciate your support. Thank you so much.
Well, thank you both for coming to tell us about this exciting new center on campus.
You're welcome. Thank you for having us. That's so nice. And he's such a wonderful spokesperson for the center, and she's doing such a wonderful. We couldn't be where we are today without the students and without the support from our communities.